After finishing training and practicing anesthesiology and critical care medicine in private practice for a few years, I was elected as president of an organization called the Greater Washington Society of Anesthesiology. Not only was I president of that organization, but I was also in charge of international medical work for the Greater Washington Society of Anesthesiology. Over time, the medical projects that we did grew to such a large degree in terms of scope, in terms of the diversity of volunteers who are participating in those projects, and in terms of the geographical input of those volunteers being nationwide, that myself and the volunteers in the international division decided that we would create another organization together, and that organization we called Doctors for United Medical Missions. So Doctors for United Medical Missions grew directly out of my work in medical missions with the Greater Washington Society of Anesthesiology. Our work in Africa has actually ranged from East Africa to West Africa, and we've even done some things in South and Central Africa. For about 10 years, I went to the country of Eritrea either every year or every other year, participated in a number of different programs and initiatives with George Washington University, Physicians for Peace, and helped volunteers overseas in that country. I've also worked with an organization called ProHealth International throughout the entirety of Nigeria, as well as working with ProHealth International in Ghana and Burkina Faso. And then more recently, I've become more involved in terms of research and clinical work in Sierra Leone and Liberia, while at the same time continuing my work in Nigeria. So right now, for the present time, the center of gravity of my work tends to be more in the West African region, although in addition to the East African work in Eritrea, we've also worked in Kenya, Mozambique, and in Malawi.